The fear of this deep vein thrombosis is that if the blood clot dislodges from the leg or from the arm and finds its way in the lungs, it will cause obstruction within the blood flow to the lungs, and that is a life-threatening condition. It can lead to death. Hello and welcome to my platform. How often do you hear that someone who was looking apparently well, healthy, boarded a flight and upon arrival at the destination suddenly passed? I want to talk today about a condition called deep vein thrombosis, a condition whereby a blood clot forms in the deep veins. This can happen within the veins in the legs, it can happen within the veins in the arms. What actually leads to the formation of this clot? Three things, come together to put people at risk of formation of blood clots. One, blood flow stasis, so blood is not flowing the way it's supposed to flow. Injury to blood vessels. And the third one is what we call a hypercoagulable state, which means that you are at a state where you are at risk of forming clots easily. So when those three things come together, the potential for clot formation is higher. Talking about blood flow stasis, what are some of the things that can cause blood flow stasis? In a video I uploaded yesterday, I talked about venous insufficiency and I explained the mechanisms by which blood flow returns to the heart. And I also said that if blood does not return to the heart through the veins as it should, blood is going to accumulate. For example, I talked about in the legs, right? Blood moves from down to up and it goes against gravity. And so for blood to move from the foot to the heart, it needs the venous pump mechanism in the legs as well as the valves in the veins of the legs to function well. And if anything obstructs these, then blood can accumulate in the legs and blood will not go to the heart as it should. When this blood accumulates in the legs, there is a risk of blood clot formation. This is what is called blood flow stasis. So what are the risk factors for development of these blood clots? Immobilization, right? It means like you're not moving about like you should, like people who are hospitalized for prolonged periods, or people who are acutely ill at home and stay in bed for quite a while. People who have cancers are at risk of developing blood clots. The risk increases with age, so people above 65 years of age are at higher risk. Medications like oral contraceptives, they are trauma, so people who have had maybe a fracture or had a cast placed on the leg, they are at risk of developing a clot within the legs, because all of these, like I said, they come together with these three things: blood flow stasis, injury to blood vessel, and hypercoagulable state. Smoking is also a risk factor. There are other inherited disorders that predispose people to having blood clot: sickle cell disease, the thrombophilia. Now that there is, right now, and at the start of the video I mentioned long flights. So let's say you bought